Hello, I'm Michael Schmidt. I'm a cardiologist and interventional cardiologist who works for DuPage Medical Group in the western suburbs of Illinois. I primarily work at Northwestern Medicine Central DuPage Hospital in Winfield, Illinois. February is a big month to celebrate heart disease, so there's always lots of educational opportunities to learn more about heart disease and its prevention and treatment. Today I was going to speak a little bit about coronary artery disease and some of its differences between men and women. So there's various forms of heart disease. When we truly think of heart disease, what we're really talking about what is known as coronary artery disease, and this is blockages in the three small arteries to the heart. So the heart has three very small arteries of about 3 millimeters, and they can develop with time little cholesterol plaques that can narrow the arteries and impede blood flow to the heart, and in an emergency situation can even cause a heart attack where the artery becomes completely disrupted and has no blood flow getting through it. There's other forms of heart disease, such as electrical problems where the heart can inappropriately beat too fast or too slow. There's problems with the heart valves. There's 4 chambers in the heart, and there's valves in between each of these chambers, and if those valves start to leak or become narrow, they can cause the heart to decompensate. In general, though, most of us are really trying to prevent is the development of coronary artery disease. The risks for coronary artery disease are diabetes, high cholesterol, smoking, high blood pressure, and family history. Genetics plays a very big part in this. The symptoms are usually chest pain or a suffocating feeling while you're being active. So while you're exercising on a treadmill, patients would typically complain of a tight feeling, often radiating up into their jaw, and when they get off the treadmill, that would be relieved with rest. That is what we would consider stable coronary artery disease, and due to the slow development of a narrowing in one of the arteries that supplies blood to the heart. An unstable coronary syndrome, or a myocardial infarction, is when there's a sudden disruption in one of these little cholesterol plaques to the heart. In that instance, a blood clot can form and completely occludes blood flow to the heart. At that point, the heart is deprived of blood flow, and essentially tissue starts dying. That's a medical surgical emergency and requires some form of treatment to improve blood flow to the heart. Traditionally, we've used very powerful blood thinners that can be administered in any emergency room to break up that blood clot. Or commonly now, we perform a procedure which is called coronary angioplasty. That's a procedure where we put a fine little tube into an artery, either in your hip, the femoral artery, or in through your radial artery in your wrist. Through that, we can put a tube all the way back to the heart. We inject dye, take pictures under X-ray, and if we find the narrowing, we're able to put a wire in that and dilate with a balloon and place a little metal stent in that. Symptoms of an actual heart attack are usually not subtle to very severe. The patient develops severe chest pain, breaks out in sweat, often has trouble breathing, and usually it needs to call 911 to get emergency medical attention. Those are sort of the classic symptoms, but in everybody's a little bit different. Particularly, women tend to have different symptoms. While often most of the symptoms are classic, sometimes the chest pain it's a little more subtle. The shortness of breath is a little more subtle. It can be a lot harder to diagnose because these symptoms are essentially the same, but of a much more subtle nature. So when a woman complains of these symptoms, we need to have a high index of suspicion to start performing the appropriate tests to evaluate for heart disease. Another difference between men and women, heart disease is much more common in men and tends to present itself at an early age. Men often have heart disease as early in 50s. If they're very high risks, such as smoking or diabetes, they can even have problems in their 40s. So it's much more common at a younger age in men. Women tend to be protected for reasons that are poorly understood. There's thought to be a protective effect of estrogen, which sort of protects the arteries from developing, atherosclerosis and coronary artery disease. So women often don't get heart disease, coronary artery disease, until they're much older, in their 70s. We used to think that once a woman goes through menopause, she would lose that protective effect from estrogen, and we actually recommended hormone replacement therapy or estrogen replacement therapy for many, many decades. It was finally proven to be disproven in a large trial several years ago, where they randomly gave women estrogen replacement therapy versus a placebo, and it's found that it actually potentially made people worse. So for the most part, overall, heart disease is very common. It's the #1 cause of death. The symptoms are usually chest pain, shortness of breath, particularly brought on by activity. Overall, the difference between men and women are mostly the same, but often a little bit more subtle in women. And then, as I stated, often a later age of presentation.